I'm Masri, Mike Gibson coming to you live from HFSA. We are talking about a multiple event analysis from a trial of Acoramidis in amyloidosis. Ahmed, these people with amyloidosis, they don't just have one event, they have many events. They are frequent flyers, and we often do a time to first event analysis, but what's a time to any event analysis show?
That's exactly right, Mike. In transthyretin amyloidosis, these patients have a lot of burden of disease, and looking at the totality of the evidence here is that exactly what we want in this, and what we did in this analysis, where all cardiovascular hospitalizations, urgent visits, and cardiovascular mortality was evaluated in the ATTRibute-CM trial, showing that Acoramidis led to a reduction in these events early on that continued to accrue throughout the trial, and that was associated with a hazard ratio of 0.51 in favor of Acoramidis over the trial duration. And if one looks at how many events were prevented, when you look at the 30-month duration of the trial, this essentially translates to 53 events avoided per 100 treated participants over that duration.
Wow. So even though you don't have that number right at the tip of your tongue, from what I just heard, I bet you wouldn't have to treat that many people to prevent one event, by my estimation.
That is exactly correct. Obviously, it's a recurrent event analysis, so you have to account for the fact that some patients contribute more than others. But if you do the math, it essentially would come close to 1 in 2 for the total duration of the treatment. Obviously, we're not talking about subsegments of that.
Right. That's one of the things about an NNT is, it depends on how long you go. The longer you go, the better the NNT. And you just presented 3-year data. Well, that is both from a relative perspective and an absolute perspective, compelling data. What I hope you guys will do is look at how many days were people alive and out of the hospital. That's another thing that regulators, patients want to know. So thanks for sharing with us, Ahmed. This is something that patients care about. They don't care about just what happens to them on the first event, but they care about the burden of disease. We as a society care about the burden of disease because we have to pay for the burden of disease. Thanks for sharing with us, Ahmed.
Definitely my pleasure.